Hello, good evening, and welcome for a new episode of Health and Fitness. Today we are celebrating, this is the week after the Eid al-Fitr al-Mubarak. I'd like to congratulate all of you for this Eid, the happy Eid for all Muslims and everybody living here in Kuwait. We're coming live from KTVT studio. If you want to participate with us, please call us at 241-2602, and our operators are 2415301, extension 34000. And our fax number is 244-4415, and our email is healthandfitness@media.gov.kw, and our area code is 00965 if you're calling from outside Kuwait. As we promised you last week, our guest for tonight, Dr. Abdullah Gholoum, is consultant psychiatrist and also from the Psychiatrist Medicine Hospital here in Kuwait. He graduated from Middle School of Ireland in 1990, and he has a Canadian Board of Psychiatry in 1998. Dr. Abdullah, I would like to welcome you here in Health and Fitness.
Hello, Ahmed. Happy to be here.
Thank you. Doctor, here in Kuwait, when we mention psychiatry, immediately they say crazy people. Why is that?
Well, unfortunately, that's the impression, I wouldn't say most people, but many people have about psychiatry, is that they associate psychiatry with the image of psychiatrists and psychiatric patients from movies, from the media, from stories they hear, and it doesn't really reflect the actual psychiatry.
Mm-hmm. So when we talk about psychiatry, what exactly are we talking about?
Psychiatry is a branch of medicine. Like you mentioned earlier, I graduated from medical school and I subspecialized in psychiatry. It took me 6 years actually in Canada to specialize in psychiatry, and it covers a wide areas of illnesses and diseases, disorders that affect the mental health. And there are areas that affect children. There is child psychiatry. There are areas that affect adults, anxiety disorders, depression, schizophrenia. There are other disorders like eating disorders, there are sleep disorders, there are personality disorders, and there are disorders that affect the elderly population, what we call geriatric psychiatry. So the scope is really wide, and we can talk forever about psychiatry.
Let's start about your hospital. How a patient can be referred to your hospital?
Well, patients can either come immediately or directly to the outpatient department, or they can be referred by physicians or other mental health or other medical care people. So people can walk in to the outpatient department, or they can be referred by doctors. We accept both.
One of the issues you mentioned, doctor, about depression now. And how can I tell that I'm depressed or I'm happy? How can I tell this? Just because I'm smiling means I'm happy? Or
No, just because you're smiling doesn't mean you're happy. But depression is a psychiatric diagnosis. Mm-hmm. Not anyone who has low mood is depressed. You can have something that upsets you at your work and with your friend or with your daily life. And you're upset, you don't want to eat or you don't want to talk to anyone. You are in a blue mood, we say. But if you are having low mood for most of the day, you don't want to talk to anyone, your appetite is low, your sleep is interrupted or increased or decreased, you are not enjoying things that you used to enjoy. And this goes on not for a day or two, at least 2 weeks or more. That's what we call clinical depression. I see people who are depressed for years, and they come to see me for the first time. They don't know what is depression. They don't know that what is going with them is called depression. But when they come and sit in my office, I explain to them, you have depression for the last 2 years, sometimes 3 years, sometimes 4 years. And it's sad because depression, although it affects the person seriously, and because they can't function, they can't concentrate, they can't go to work, they don't mix with people, their friends, they don't enjoy the pleasurable activities.
They cannot sleep at night.
They don't sleep well. They live, kind of a miserable condition.
Or the opposite, they sleep too much.
Or they can sleep too much.
Yeah.
The appetite can go low, they can go down, or it can also go up. Sometimes people eat too much, and that can be also a sign of depression. So people tend to blame themselves. Something wrong with me. I'm weak. I'm not good. I should help myself. But in fact, people with depression, they can't. They need help. They need a professional help from psychiatrists, from psychologists. They need professional help. And the statistics show that up to 60% of people who are depressed, they don't seek help. So we treat only 40% of the people who have depression. So it's very common, but it's, untreated.
So why they don't come in for treatment? Why is that?
Well, that's a good question, because people don't know that this is depression. People who know that they have depression, they don't want to go see psychiatrists because of what you mentioned earlier. People's idea about psychiatry, it's only a specialty for crazy people or, severely ill people, where in fact, proper psychiatry or, the everyday psychiatry is not what the people think about schizophrenia or patients who are in hospital. 80% of psychiatric patients are outside the hospital. Only 20% are admitted to the hospital because they are either danger to themselves or danger to others. But the majority of psychiatric patients, they can be treated as an outpatient program. But again, people don't want to go to the psychiatry hospital, don't want to visit the psychiatrist. Stigma, or these are mostly the reasons that people's fear about maybe I go to the psychiatrist and then he give me some medications and then I'll be addicted to the medication, I'll be dependent on the medication. So many reasons stop or forbid people from coming to visit the psychiatrist.
Doctor, when you mention crazy, how do you define scientifically? How do you define the word crazy?
Okay, well, crazy.
Or in America say wacko.
Okay, crazy, let's put it this way. It's the lay word for what we describe in psychiatry as psychotic. A psychotic person is a person who does not have touch with reality. So what do I mean? So the person will be having ideas that there are people following him. Strong belief that there are people following him, that there are cameras put in his home, that there are people talking about him or plotting against him. So these are this is usually not real. It happens. Sometimes people can talk about others or can plot against, but when it's an illness, there is usually no reality to it. It's only the patient's belief that he is being followed or he is being targeted. When the person believes that he's hearing a voice talking to him or seeing some kind of visions that are, and there is nothing there, this is also, we call it psychosis, because the voice and the vision that he's experiencing, he or she is experiencing, has no reality to it. So losing touch with reality is what we call psychotic.
There is a movie, a math teacher, Russell Crowe, it was acted by Russell Crowe. He was like this. He was seeing people that they're following him, and the same people, when he gets older, same faces.
Exactly.
That they're plotting against him.
Exactly. His diagnosis is schizophrenia, and he has the belief that other people are watching him and talking to him, and so this is an illness, and this is psychosis.
So what do you call mental retarded people then?
Okay. Mental retardation is a separate category. People whose intellectual quotient, IQ. There is a test called IQ, the average intelligent quotient. Yeah. No,
but this is for the United States.
No, it's worldwide.
The same test in the States,
yes.
you can apply it here?
Yeah, with some modifications. You modify it to the culture, but the basic principle is the same in all intelligence testing. And the average IQ for a normal person who doesn't have any mental retardation is about 100. So there are people who are below 100 and people above 100. But this is the norm and this is the average. So mental retardation is when the IQ is below 100. It can be from 50 to 55. It can be from 55 to 70. It can be from 70 to 90. And each one is a category. There is severe mental retardation. There is moderate. And there is mild mental retardation, or what we call even borderline mental retardation, that are close to the norm. So people with mental retardation, they have poor judgment. It doesn't mean that they are, what again, you're using the word crazy or psychotic. No. But some patients who have mental retardation can develop psychosis. They can hear voices at times or have some belief. But not every patient who has mental retardation is psychotic or he hears voices. So mental retardation is just, we are talking about the intelligence of the person.
Sometimes in the movies, doctor, especially the Egyptian movies, old 1950, like we see one guy who was normal, then suddenly something happened, he started laughing, means he became crazy. Is this is logical? I mean, this is scientifically...
You see, this is my point. Sometimes in the movies, they don't really reflect an accurate picture of psychiatric illnesses. And, I don't know, some people find it funny, some people find it strange, some people find it otherwise. But, these things don't usually happen this way. There is more drama in TV, in the movies. We watched, there was a Kuwaiti Kuwaiti episode that was shown in Ramadan, and there was a female personality who had a psychiatric illness and who was admitted to the psychiatric hospital. Some of it was, some of the information that was displayed was accurate, but some of it was a bit exaggerated. And, this is for the media purpose, but it doesn't happen that way.
So they should consult a psychiatrist before they do this.
It should be the case.
They should be. Let's go back to depression, because I did not finish this, doctor. Some people said, I pray, I recite Holy Quran, I go to Hajj, I do all religious things, and I'm still depressed.
Okay.
So is this something to do with religion or something?
Well, there is this misconception that if I'm a good person, I'm a good husband, I do my work well, then what's the reason? And I pray, I do my prayer. There is no reason for me to be depressed. But this is not true, because anybody can be depressed. Young, adult, and old. All of them can be depressed. I treat kids who are 10 or 12 years old that are depressed, adults that are 30 and 40, and people who are in their 60s and 70s that are depressed. So depression comes to all ages, both sexes. It's more common in women. And usually, you're asking about what's the reason for a person to be depressed? What's the cause? There is a genetic basis to all psychiatric disorders. We can broadly say that. So if your father had depression, a person is more at risk of developing depression. And not father, maybe uncle, maybe aunt, maybe some... if there is a family history of depression, then the person from that family is at risk of developing depression. So this is the strongest cause we have for depression. Now, there is no family history. A person can still be depressed. And because of there is a neurochemical imbalance, or a chemical imbalance that happens at the brain level. And there is a substance that's called serotonin. Serotonin is the chemical involved for people who